Hi, my name is Azim Shabir. In this presentation, I'll be discussing and analyzing assertive communication, its challenges, strengths, and its usage in health and social care practice. One such practice is communication in healthcare and how professionals communicate with patient and fellow colleagues influences both patient outcomes and safety. And consequently, hi, my name is Azim Shabir. In this presentation, I will be discussing and analyzing assertive communication, its challenges, strengths, and its usage in health and social care practice. One such practice is communication in healthcare and how professionals communicate with patients and fellow colleagues influences both patient outcomes and safety and consequently quality of care. The aim of this presentation is to critique assertive communication and how it promotes and enforces effective practice, but also discuss its practical challenges. In health and social care settings, communication is not just about passing on information, it has intrinsic ties to patient safety, emotional well-being, and clinical effectiveness. Poor communication is one of the leading causes of medical errors. Therefore, good communication or use of proper styles. The second reason is that assertive communication is important as it is a tool for all professionals to communicate without losing the spirit of respect and empathy. Here I will describe assertive communication, discuss its characteristics, outline its advantages and drawbacks, and discuss its implementation in actual health care situations. Assertive communication is defined as the capacity to voice one's thoughts, feelings, and needs clearly and confidentially, while also respecting the rights and perspectives of others. It is a spectrum between passive communication, where people may hide their communication, and aggressive communication, where they ignore others' emotions. In medicine, this is an important balance. Professionals should be honest and direct about treatment or risk, but at the same time, they should be attuned to patients' emotionally states. So, assertiveness provides both clarity and compassion, and it is an effective communication style in a clinical environment. There are several key features of assertive communication. Firstly, using I statements help individuals express their feelings clearly without blaming others. Secondly, maintaining eye contact shows confidence and engagement. A calm tone of voice is important to avoid conflicts and keep communication respectful. Active listening is also essential as it helps improve understanding between people. Finally, a positive body language supports effective communication and shows openness. In health and social care, we know assertive communication is imperative to ensure patients comprehend their disease, treatments, and treatment plans. Effective communication has a vital impact on the patient who will make medical decisions based on these critical principles of ethics in health care practice. It also inspires trust between healthcare workers and patients, something that is critical for both cooperation and treatment there. Moreover, being sure of oneself in this regard is also a confidence booster, and the risk of people not understanding the other and is reduced. When communication is assertive, which results in lesser risk of medical mistakes or treats to patient safety. It provides clinical outcomes and patient satisfaction because of the convergence of clarity and respect. One particularly strong feature of assertive communication is that it enhances respect and dignity, both of which are fundamental in healthcare. It creates strong professional relationships that enables patients to feel cared for and valued. It also promotes openness so that the patient can better know which medicine they are being given and understand what their choices are. In addition, assertive communication is able to lower the amount of conflict within and build cooperation between patients, leading ultimately to the improvement of standard of service as a whole. In practice, assertive communication facilitates medical professionals in being able to clearly explain the course of treatment so that the patient can make better decisions while maintaining clarity and predictability of what is expected of them. This potentially encourages patients to make a more active role in their own healthcare, to take over responsibilities related to their sense of independence and self care. It is also enables collaborative decision making, in which patient and healthcare professionals team up to determine the right action to take. Moreover, the initiative helps healthcare workers to build confidence and to convey their message in highly announced or high pressure circumstances. This is just shows how being in charge in communication is not just a theory but real life practice. This assertive communication has many benefits but does have its limitations. Sometimes it could be seen as too blunt or too explicit, especially for patients who are emotionally fragile. It might even come across less well in emotional situations. For instance, when delivering bad news, since empathy and sensitivity may have to be the priority. Culture distinction is also the key to interpretation of assertiveness. For example, some regions might consider assertive interaction can be offensive, others simply lack the confidence or ability to act assertively. Applying assertive communication in healthcare settings also comes with practical challenges. To provide an example, working with the vulnerable patients, such as those with mental health conditions, we must be mindful in adjusting our styles of communication. Language barriers can also make communication more challenging, which makes it easier to misinterpret. Emotional situations like end of life care requires a more tactical modality, one that strikes the right balance between assertiveness and empathy. And time is of the essence is a busy environment. And in medical settings, one should never forget the chances to have an effective conversation. Assertive communication strongly supports person-centered care, which treats patients as individuals with specific requirements and preferences. To put a good value on that, as a result of this clear and respectful communication, healthcare professionals can better understand each patient's circumstances. This promotes patient involvement in decisions that ultimately result in more individualized and effective care plans. This also ensures trust and empathy, which are crucial for providing high quality care. Assertive communication is just as powerful as it is with other members of healthcare teams. It aids in clear communication among colleagues, minimizes the chances of any risk, any mistakes, and any miscommunication. It also the glue that fosters collaborative working and ensures that teams stay focused toward common goals. Effective teamwork is vital in healthcare. Effective communication plays a key role in achieving this. To become a better assertive communicator, healthcare providers may need to receive training in communication skills, which increases one's confidence and competence. So, too, is fostering cultural awareness. So, clinical staff must be better able to meet patient needs and communicate in a manner suited for the patient. The knowledge gained through reflective practice can direct the individual towards improvement, while feedback from colleagues from across the health world can provide valuable insight into the practice we will perform next. Communication should, in the end, be adaptable and specific to the individual. To conclude, assertive communication is an important skill in health and social care. It generates clarity, respect, and necessary steps of patient care. Nevertheless, recognize that its virtues are not enough, especially in an emotive situation and in a cultural content. Collectively, assertive communication that is used properly enhances both patient outcomes as well as the quality of care it delivers. Thank you very much for the